Hey, healthcare heroes. Have you ever cared for a patient who says they just don't feel like themselves, exhausted, withdrawn, and losing interest in everything? You may actually be seeing signs of major depressive disorder, or MDD, which is a leading cause of disability worldwide, and honestly, it often hides in plain sight. So, let's explore the symptoms, causes, and some evidence-based care strategies that nurses can use to support patients through the fog of depression. Major depressive disorder is a mood disorder that's really characterized by a persistent low mood and a loss of interest or pleasure in daily activities, lasting at least 2 weeks and impacting function. So, the symptoms include things like a depressed mood, anhedonia, which is that loss of interest or pleasure, changes in sleep and appetite, fatigue or low energy, difficulty concentrating, feelings of worthlessness or guilt, psychomotor agitation or slowing, and even suicidal thoughts or behaviors. For a diagnosis, you need 5 or more of these symptoms, including either depressed mood or anhedonia nearly every day. Alright, so what actually causes major depressive disorder? Well, there are several roots. Biologically, it can be due to imbalances in neurotransmitters like serotonin, norepinephrine, and dopamine, or HPA axis dysregulation, which is all about the body's stress response. Genetically, there's an increased risk if you have a family history. Psychosocial factors can play a big role too. Things like trauma, grief, or chronic stress. And don't forget about certain medical conditions and substance use like hypothyroidism, chronic pain, or alcohol and drug abuse, which can also contribute. When it comes to treating depression, there are several options we can consider. First up, pharmacologic therapy. Selective serotonin reuptake inhibitors, or SSRIs, are usually our first-line choice. Think medications like fluoxetine, sertraline, and citalopram. Then there are serotonin norepinephrine reuptake inhibitors, or SNRIs, such as venlafaxine and duloxetine. We also have atypical antidepressants like bupropion and mirtazapine. Tricyclic antidepressants and monoamine oxidase inhibitors, or TCAs and MAOIs, are used less frequently these days, mostly because of their side effect profiles. It's important to remember and to remind our patients that antidepressants often take about 2 to 4 weeks to show their full effect, so we really need to educate folks on the importance of sticking with their medication. Moving on to psychotherapy, cognitive behavioral therapy, or CBT, is the most evidence-based approach. But there are other options too, like interpersonal therapy, behavioral activation, and group therapy. And for cases that are resistant to standard treatments, or especially severe electroconvulsive therapy, or ECT, might be considered. We're also seeing emerging options like transcranial magnetic stimulation, or TMS, and even ketamine or esketamine. So, what are our top priorities as nurses caring for someone with depression? First and foremost, we have to assess for risk of suicide. That means asking directly about any suicidal thoughts, evaluating access to means, and understanding if there's a plan or intent. If needed, we'll implement safety plans and even provide one-to-one supervision. Next, we need to monitor how patients respond to medication and watch for side effects. Serotonin syndrome is one to look out for. We should encourage patients to stick with their medication and make sure they follow up with their prescriber. Also, keep an eye on energy levels. Sometimes, as energy returns, the risk of suicide can actually increase. Building a therapeutic rapport is key too. We want to be present, non-judgmental, and patient. Avoid giving false reassurance and instead, validate their feelings. Encourage them to set small achievable goals. And finally, education is huge. Remind patients and their families that depression is a medical illness, not a character flaw. Teach them to spot early warning signs of relapse, and promote routines that support healthy sleep, nutrition, and exercise. Depression isn't always loud, but its silence can be devastating. As nurses, we really do have the chance to spot it, support healing, and bring hope into the hardest moments. So, what strategies help you support patients with depression? Share them in the comments below. And don't forget to like, subscribe, and follow for more mental health care content, because recovery begins with recognition.